Assalamu alaikum. Welcome to Doctor's World. Our topic of discussion is anti-Parkinson's drugs. In this video, we will only discuss the dopamine precursors. Dopamine precursors are levodopa, and we almost always give carbidopa along with the levodopa. Why? We will see in the mechanism of action. Here we draw the blood-brain barrier. When we give levodopa, then it can cross the blood-brain barrier by the help of amino acid transferase, a transporter. In the brain, this levodopa is converted into dopamine by the help of enzyme dopa decarboxylase. There are some minor pathways we are not discussing here. Are by the action of monoamine oxidase, it is converted into its metabolites, and by the action of COMT, it is converted into its metabolites. Selegiline inhibits this monoamine oxidase, while tolcapone inhibits this COMT. Now in the periphery, this L-dopa or levodopa is converted into dopamine by the action of peripheral dopamine decarboxylase, and if it is converted, then the levels of dopamine for the brain are decreased. So to inhibit this dopamine decarboxylase, we use the carbidopa. This drug is mainly used to treat Parkinson's disease. It should be remembered that this drug does not cure this disease, but this drug only slows the progression of the disease. It should also be noted that response fluctuations are seen with this drug and are related mainly to the timing of the levodopa dosing. That is, there are off periods of akinesia that alternate over a few hours with on periods of improved mobility, but often with dyskinesia. This is known as on-off phenomenon. These off periods can be treated by using apomorphine, that is a dopamine agonist. Apomorphine is a dopamine agonist. We will discuss it in the other video. Now we will discuss what is the toxicity or adverse effects of levodopa. The adverse effects of levodopa are postural hypotension, reflex tachycardia, asystole, arrhythmias. These are on the cardiovascular system. On GIT, emesis, anorexia, and nausea, etc. are seen. Tremors, chorea, bawlismus, agitation, confusion, hallucinations, delusions, depression, and other adverse effects are seen in the CNS. This drug is contraindicated in the patients with a history of psychosis and also in the patients with the history of ulcers and myocardial infarctions. Thank you. This is all about the dopamine precursors and carbidopa.